Hi,
we're
Dr. Friends.
Our helpers have requested a lot about ADHD.
ADHD is a disorder that's getting more and more attention.
It's called Attention Deficit Hyperactivity Disorder, affecting both children and adults with symptoms of inattention, hyperactivity, and impulsivity.
That's a bit difficult.
These days, many people know about it, so they might say they have a rough idea of what it is. They might say it's being distracted. They might hear that they are very active, and in ADHD, symptoms can be divided into two categories: inattention and hyperactivity impulsivity.
Categories.
So it's about being inattentive.
Being distracted.
Inattention includes being easily distracted, having a short attention span lacking persistence, and quickly losing interest. These are core symptoms of inattention. Additionally, hyperactivity and impulse second symptom group, characterized by excessive movement, restlessness, and impulsive actions. And then there's hyperactivity and impulsivity. It's about being restless.
Moving around.
In kids, they move as if motors are attached, constantly on the go. Adult ADHD is quite common these days too, with many adults experiencing similar symptoms.
Yes.
Adults don't do that. They can't just keep moving around at work. For adults, hyperactivity might mean feeling restless, unable to sit still. But for kids, it can be more obvious, like shouting in school, talking to friends, while the teacher is teaching and continuing even after being told off several times. This is what we often see as hyperactivity. Impulsivity is also present, such as not being able to wait their turn or interrupting others. These symptoms are quite common in both children and adults, although they manifest differently in each group.
What?
Can't wait their turn.
Cutting in line.
Cutting in line or interrupting before a question is finished, or answering out of turn are impulsive behaviors linked with hyperactivity. So, we categorize activity in the two main types: inattentiveness and hyperactivity, impulsivity. For inattentiveness, parents often bring their children in, saying they are very distracted, won't do anything without constant reminders, or need constant nagging to get things done. They might describe their child as restless, which indicates inattentiveness. It's a common concern for many parents.
Does that count as inattentiveness too?
It does. But the tricky part is, as kids, it's naturally hard for them to focus.
That's true.
That's why even elementary classes are short.
They're short.
Right. But from a parent's perspective, it's hard to know when they should take their child to see a doctor, or if it's just normal behavior.
It's challenging because kids naturally have those tendencies.
Right. But sometimes teachers at daycare, kindergarten, or elementary school talk to parents about these issues. They have years of experience, teach many children, not just one or two, which gives them a broad perspective to share with parents.
Because they see many kids.
Exactly, so they have a rough average understanding. As Dr. Wu mentioned, children naturally have short attention spans, which is a common trait.
Exactly.
But if a child stands out more, teachers nowadays, trained in their education programs about ADHD, might suggest taking action. They learn about these things in graduate programs and offer valuable guidance.
So, if teachers suggest something, parents shouldn't ignore it.
That's because teachers don't bring it up lightly.
Right.
They observe over time and then suggest consulting a professional, leading parents to seek expert advice. When there are such reports, most of the time it's diagnosed as ADHD, so the teacher's observations are really crucial. When parents bring their kids in, they often say, "My child focuses well when playing games, so they can't have ADHD," right? But that's not always the case. But even kids with ADHD can focus well on things they like. Just because they focus well on games doesn't mean there aren't issues at school or academy. It's good to seek advice and maybe visit a professional. Inattentive types often struggle to focus on tasks or play and tend to lose things frequently.
I lost so many things.
Really?
I often lost my bag as a kid.
You lost it.
I'd leave it behind at places like arcades.
Oh, just spacing out while watching?
Yes. I'd often put my bag down while gaming and forget it. I lost it several times at the arcade.
Are you good at organizing items or collections?
He's not good at it.
I'm good.
Or meeting deadlines?
And liar.
Are you good at meeting deadlines and sticking to them?
I do keep deadlines.
He doesn't keep them well.
Deadlines?
He changes the deadlines.
I keep deadlines.
Oh, you change and keep?
Yes, both.
In cases where tasks can't be done sequentially, it might be due to the inattentive type of ADHD. People don't know what's important. They do a bit of this or that, but they can't focus for long. This is called the inattentive type. In adult ADHD, this inattentive type is more noticeable than in children.
I'm not sure about other things, but I frequently lose belongings.
I got tested once, and I think it would be good for you to get tested too. You should come to the hospital and get that test done. The hyperactive type is more apparent. Kids are always climbing on tables or ladders.
That sounds a bit dangerous.
Right? They often get hurt and fall frequently. Hyperactivity and impulsiveness are more noticeable than the inattentive type, leading to more injuries and accidents.
Is the diagnosis quicker then?
It can be quicker as it's noticeable. That's why it's called quiet ADHD or the inattentive type. Hyperactivity and impulsiveness are more apparent and can be noticed by non-experts. However, hyperactivity tends to decrease as one becomes an adult. You can't just roam around at work during school classes, as I mentioned earlier. This change is part of adapting to social norms.
Socialization.
Right? It's part of socialization, but even when sitting, inattentive ADHD can persist. ADHD can cause issues in friendships and relationships. For example, frequently interrupting friends or roaming during class can lead to scolding by teachers and teasing by friends. This lowers self-esteem and focus, which can drop academic performance. As a result, individuals may struggle with maintaining friendships and feel isolated, impacting their social
Scolded a
development.
lot.
Being teased by friends and scolded by teachers can lower self-esteem, affect concentration, and decrease academic performance, leading to frustration and a loss of interest in studying. This can lead to frustration and a loss of interest in studying, which can be a significant issue.
That's quite serious.
Because of academic concerns, many people worry and sometimes overact by taking kids to the hospital. There are always differing opinions, but communication with teachers can be important.
When you come in for a consultation and it doesn't seem like ADHD, we often reassure parents and send them off. We observe the children, consult with them, and ask about their behavior at school, home, and academies to diagnose. Consulting a specialist is crucial. There is also the continuous performance test, which I'll show you later. It's like a game on a computer screen, making it easy for children to follow. This helps us make accurate assessments and ensures children receive the right support.
Do not press the button on the X shape. Press the start button to begin the test.
Through such tests, we can objectively measure and diagnose ADHD. If you suspect ADHD, it's beneficial to get a consultation. Medication is surprisingly effective in managing symptoms and improving focus. Medication for ADHD is quite effective. Through tests like the continuous performance test, we can measure reaction time and false responses. If your child seems different compared to other children at daycare, consider getting a test. Symptoms can persist into adulthood, affecting emotional and academic aspects. I recommend getting a test. If you have more ADHD questions, please leave a comment and we'll prepare another video to address your concern. If you know someone curious about ADHD, sharing this could be helpful. Thank you.
Thank you. To those who watched until now,
If you want to see more videos here,
is it here?
here.
Here it is.
To keep watching our fun videos, hit subscribe and we'll keep up.
Subscribing is health.
We love you,
love-
help friends.
See you again.
See you again.